First of all, when you check ECG, you need to check control wave. If control wave exactly 10 millimeters, quality of ECG is good. Next one, you need to check rhythm, check pacemaker in patient. To do it, you need to find P wave in second intercostal space. In this case, P wave is absent. If P wave is present, it is sinus rhythm. If P wave is absent, it is non-sinus rhythm. Next one, you need to check distances between RR waves to find regularity of the rhythm. If distance is similar, it is regular rhythm. If distances are different, it is irregular rhythm. In this case, it is regular. Next one, you need to check electric axis of the heart. You need to compare R waves in first, second and third leads. I take ECG like this. First lead in left arm, third lead in right arm. If the BJ star wave in my left arm, it is shift to the left. If the BJ star wave in right arm, shift to the right. If the BJ star wave in middle, it is normal electric axis of the heart. In this case, it's practically similar.
So
it is signs of shift to the left, it is to the right, I'm sorry. It is vertical electric axis of the heart. Because there are stages of shifts. Normal electric axis of the heart, horizontal, shift to the left. Normal, vertical, shift to the right. In this case, vertical electric axis of the heart. After this, you need to check all changes in all leads and waves and intervals. In this case, you can see absence of P wave and big F waves in this place. It is atrial flutter. Control wave, P wave is absent. We can see big F waves in this place and irregular rhythm. Atrial flutter, but in difference from this card, this one regular rhythm, this one irregular rhythm. Numbers of waves different every time. Numbers of F waves similar every one time. This one correct type of atrial flutter. This one incorrect type of atrial flutter. When you check cards with tachycardia, you need to compare sizes, check size of QRS complex. This patient has tachycardia and QRS complex thing, it's normal. Size of QRS complex less than 0.12 seconds. That's why it's supraventricular tachycardia. To find is it sinus or non-sinus tachycardia, we need to check P wave. P wave is absent, it is non-sinus supraventricular tachycardia. In this case, rhythm is regular, but QRS complex wide and deformed. This one, ventricular tachycardia. In case of supraventricular tachycardia or supraventricular extrasystole or any another supraventricular changes, you will see small complexes. In case of ventricular changes, you will see wide or deformed QRS complex. This ventricular changes, this one supraventricular changes. Regular rhythm and wide deformed complex, ventricular tachycardia. What patient feel in these two cases? What is the patient's sensation?
Death.
It's a clinical death. Patient don't feel anything. Examinators like ask you during exam. Patient with tachycardia, 141, thin complex QRS, small complex, supraventricular tachycardia. P wave is present. This one, sinus tachycardia. Irregular rhythm and P wave is absent. What is it?
Non-sinus.
Atrial fibrillation. Some kind of tachycardia. Sync complexes, that's why supraventricular tachycardia, P wave is absent. Non-sinus supraventricular tachycardia. What is it?
D wave.
Normal, something abnormal. This one, extrasystole. Complex deformed, different with this one, with previous complexes. That's why it is ventricular extrasystole. Before extrasystole, you can see short distance. After extrasystole, you can see if we will have more cuts, you will see long distance, compensatory pause. Before short interval of connection, after extrasystole, long compensatory pause. Why deformed complexes? That's why ventricular extrasystole. You can see very small R wave, deep S wave, elevation of ST segment, biphasic T wave. Elevation of ST, negative T. Elevation of ST, negative T. Negative T, negative T, negative T. Elevation of ST is sign of myocardial infarction or stenocardia. If Q wave appear, it is myocardial infarction acute stage. Without Q wave, we cannot say about it. At this moment, Q wave is absent. It is S wave. That's why it is. We cannot differentiate. It is stenocardia or myocardial infarction. Our conclusion is acute coronary syndrome. After this, we need to do troponin test. If troponin test is negative, it is stenocardia. If troponin test is positive, it is first stage of myocardial infarction. After some time, this wave will Q wave and it will acute stage of myocardial infarction. This patient needs stenting. Normal complex, something abnormal. Normal complex, abnormal. Normal, normal, normal. Short distance here, long distance here. What is it? Wide deformed complex, which appears sometimes. Ventricular extrasystole. This card with hypertrophies. The biggest R wave in first lead, small R wave in third lead, this shift of electric axis of the heart to the left. Deepest wave in V1, V2, big R wave in V5, V6. It is hypertrophy of the left ventricle. In this case, big R wave in third lead, small R wave practically absent, R wave in first lead. Shift of electric axis of the heart to the right. Big R wave in V1, deepest wave in V5, V6. It is hypertrophy of the right ventricle. It's similar. Shift of electric axis of the heart to the left, the biggest R wave in first lead, deepest wave, small R wave in V1, V2, big R wave in V5, V6, hypertrophy of the left ventricle. Same. Electric axis of the heart is normal, but very deepest wave in V2 and V1, big R wave in V5, V6. This one, hypertrophy of the left ventricle. Doubling of P wave. M like P wave. P mitrale. Hypertrophy of the left atrium. P mitrale.